Right now, today, inside roughly 10% of all reproductive-aged women, a complex biological machine is breaking down. The condition is called Polycystic Ovary Syndrome, or PCOS, and its most recognizable symptoms are irregular periods and unexplained infertility. The name polycystic is actually a diagnostic misnomer. It identifies the condition based on a biological feature that doesn't technically exist. While the symptoms manifest in the ovaries, the reproductive system is essentially caught in the crossfire of a much larger metabolic conflict. When doctors look at an ultrasound of a patient with this condition, they point out what they call cysts, but they aren't looking at fluid-filled sacs or tumors. These are immature follicles. They are healthy eggs that started to develop, but were frozen in time. Without the chemical signal to release, these stalled follicles accumulate. You can see 20 or more of them piling up like a traffic jam along the outer edge of the ovary. The ovaries are perfectly capable of producing eggs. The question is, what unseen force is sabotaging the biological machinery and halting ovulation? For roughly 65 to 95% of patients, the root cause is a metabolic malfunction known as insulin resistance. Normally, insulin signals cells to absorb glucose. In a resistant state, cells ignore that signal, leaving glucose to accumulate in the bloodstream while the cell starves. The pancreas responds by flooding the bloodstream with a massive wave of insulin to overcome the resistance, called hyperinsulinemia. This insulin surplus triggers the liver to suppress production of sex hormone-binding globulin, or SHBG. SHBG normally captures and deactivates testosterone. With less SHBG produced, the concentration of free, biologically active androgens begins to climb. This insulin flood continues directly into the reproductive system. Inside the ovary, high insulin combines with luteinizing hormone to overstimulate the theca cells. These cells get hijacked, turning into runaway factories that rapidly pump out even more androgens. This toxic, high androgen environment stalls those follicles in the first place. It also triggers the severe acne and abnormal facial hair growth that patients physically experience. The elevated androgens actively worsen insulin resistance, forcing the pancreas to produce more insulin, locking the patient into an inescapable loop. This hormonal feedback loop cascades outward, damaging organ systems far beyond the reproductive tract. Because of this systemic threat, leading medical authorities in the 2023 international guidelines are pushing to rename the condition to PMOS, Polyendocrine Metabolic Ovarian Syndrome. The metabolic side of the condition accounts for vastly increased risks of type 2 diabetes, cardiovascular disease, and obstructive sleep apnea. There is also a severe psychological toll, including high rates of anxiety and depression. And because the uterine lining isn't shedding regularly, patients face an increased premenopausal risk for endometrial cancer. But this biological machine can be reset using a multi-front strategy. Medical interventions start with Metformin to break the cellular insulin resistance, alongside letrozole, the primary pharmacological therapy used to successfully restart ovulation. As the current international guidelines show, heavily marketed alternative supplements like inositol are still considered experimental, as the available evidence is too uncertain to recommend them as primary fertility therapies. Treatment also relies on combined oral contraceptives to protect the uterine lining, paired with stigma-free, non-weight-centric lifestyle management to naturally improve insulin sensitivity. PMOS is a systemic warning sign, but it can be strategically managed. Share this video to help millions understand the science, break the cycle, and take back control of their health.